Good morning, Senator Eggman. Thank you for taking the time to meet with me this morning. Thank you for all the work you've done for patients over the past 5 years to eliminate barriers to the End of Life Option Act. This is a great opportunity for us to meet and talk about barriers that still exist that deny access to medical aid in dying for some patients.
Good morning, Ms. Garcia. It is great to meet with you this morning and discuss this topic that is near and dear to my heart.
Can I start by telling you about one of my close friends, Sandy Morris? Sandy has been a resident of your district her entire life. This is a picture of Sandy and her husband from 2018. Sandy is 55 and she's worked in business management for Hewlett Packard for over 28 years. In early 2018, not long after this picture was taken, she began to experience some weakness in her left foot, and the weakness didn't improve. After months and months of following up with specialists, she was just diagnosed with amyotrophic lateral sclerosis, which is also known as ALS or Lou Gehrig's disease. As you know, ALS is a progressive neurological disease that's incurable, and it will eventually result in her death. As the disease progresses, patients may experience profound muscle weakness and atrophy, the inability to move, inability to speak, inability to swallow, and the inability to breathe. The average survival rate from the time of diagnosis for an ALS patient is 2 to 5 years. And the progression of the disease is usually quite rapid, and it's not predictable the sequence that it will progress. It varies from person to person.
I'm very sorry to hear about your friend's diagnosis. I'm sure it's been very difficult for her and her family.
It's been very difficult for her and her family. This is a recent picture of Sandy and her 20-year-old son sitting on the porch, spending precious time together. And as you can see, Sandy's disease has progressed, and she has very limited movement from her chin, below the level of her chin. But Sandy is still very much alive, and despite her disabilities, her life is still meaningful. And the reality is that Sandy knows that her disease is going to continue to progress until she is no longer able to breathe. Sandy made the decision, it was a difficult decision, but she made the decision to use the End of Life Act to end her life when she is ready. She wants to not suffer and wanted to have a dignified and comfortable death that was on her terms. But sadly, as Sandy pursued this option, she discovered that the California law requires that the medication prescribed for End of Life Option Act has to be self-administered. Right now, Sandy is being faced with having to make a choice to end her life early while she's still able to self-administer the medication, or risk the ability of losing her rights to participate in the End of Life Option Act and experience a long, drawn-out death by suffocation.
That is a very difficult position for your friend to be in. When I drafted the End of Life Act, there were many safeguards that were included in the bill to prevent misuse and abuse. The requirement for self-administration was included to ensure that the act was voluntary and not a result of coercion, murder, or euthanasia.
I would also like to take this opportunity to tell you a little bit more about my organization and how we advocate for the End of Life Option access for all patients with terminal diagnosis who want to receive medical aid in dying. Serene Passages was founded in 2015, and we have 17 chapters located in major cities throughout California. Serene Passages is comprised of volunteers who are all healthcare professionals, and we're also partners with more than 50 organizations that are national or statewide that support honoring patient autonomy and the right to die with a terminal diagnosis. Some of our state and national partners include Dying with Dignity, California Hospice and Palliative Care Association, California ALS Association. One of the biggest challenges right now that my organization is facing is ensuring fair and equitable access to all patients that have a terminal diagnosis who would like to pursue this option. Serene Passages, we provide public speaking and education for healthcare professionals and the public. We are a patient resource. We also lead end of life state conferences, and we provide state to other support to other states that don't have legislation in place for end of life options. I do understand your intent for including the requirement of self administration in the End of Life Act, and your concerns that the third party administration of the lethal medications to the patient can create a slippery slope. The End of Life Option Act does have many safeguards other than self administration that validate the clarity of the patient's decision to participate. Furthermore, the End of Life Option Act does not clearly define what self administration is, or it doesn't really provide a process for enforcing that, which makes it kind of a moot point. Administration of the lethal medications by others is allowed in Canada, and the data that they've collected has demonstrated that there have been no indications of abuse or misuse of the process.
Well, certainly, out of respect and dignity for terminally diagnosed patients, I am in support of reviewing the safeguards in the bill and interested in learning how we can ensure fair and equitable access to the End of Life Act. I think that we both agree that third-party administration of the lethal medication has the potential to create a slippery slope, and we need to ensure a safe practice preserving this act for those terminal patients who truly and autonomously make the decision to end their life. How can I help support your efforts?
One of Sandy's favorite quotes is, "What you allow is what will continue." And I'm here today to ask you, as the author of the End of Life Option Act, for your support to ensure fair access for the End of Life Option Act for all patients with a terminal diagnosis, and to consider open discussion with a group of stakeholders, experts, and fellow state senators to propose changes and draft an amendment to the bill that would remove the requirement for self administration for the End of Life Option Act, allowing the patient to have access to the lethal medication administered by others if they meet all other requirements. I really want to thank you for your time meeting with me today, and I'm going to go ahead and leave you with this brochure. This is a little bit about my organization and the work that we do in support of all patients at the end of life. Thank you again for your time.
Thank you very much.